The history of TB Europe Coalition is an interesting one. It's an organization that has changed its focus at least once. Originally, it was created by civil society, non-governmental organization activists in Western Europe. There were a number of us in the early noughties who were concerned about pushing the European Union to do more for tuberculosis and to start making links with groups further east. There was one attempt of an organization that failed, the Stop TB Partnership Europe, where Stop TB Partnership Global actually put up some money to pay for a staff member who was attached to International Red Cross and Red Crescent. And I was involved in that, but we got lost in conversations about structure and constitution, and we didn't actually get to do anything very much. And when no money came after a couple of years, we weren't able to find alternative funding. That everybody had rather naively thought that the European Union would be an easy touch. It wasn't. And by the end of 2008, it had disappeared. But about this time, the French organization Global Health Advocates appointed a person to be their their advocacy person in Brussels, running the corridors of the European Union. And they agreed that this person should spend a good part of their time on tuberculosis-specific activity. That was a woman called Charlotte Goyon who was appointed, and early on she convened a meeting which took place in the middle of 2009, which I recently found the minutes of. And in a way, one can call that meeting the founding meeting of TBEC. We mostly talked about how we were going to collaborate on lobbying the European Parliament. Only right at the end of the meeting, there was a little agenda item which was, how might we continue to link up with each other? And do we need to do anything about Eastern Europe? And it was agreed that none of us knew anybody in Eastern Europe, and that we really ought to, and that we ought to have a bit of an organization to do anything. So we rather casually said, okay, we're the TB Europe Coalition. One of our Dutch members, Beatrice Stickers, had begun using that phrase. And we said, that sounds okay. And I was asked to start poring over the address lists held by Stop TB Geneva and other people that might help us know who to try and talk to in the East.
My personal involvement started in 2007, helping to organize the ministerial conference on TB response in the Euro region. And at that conference, the 52 countries of the region signed up to step up the TB response. And from civil society, we made an offer of partnership to the national NTPs and governments that we would be helpful as partners. A next moment was around 2009 when we interested Dorette Corbeil, a Dutch Euro parliamentarian, and she sponsored a petition in which we reached out to almost all members of parliament to sign up. We only had a very short window of time, but in 40 weeks we got, I think, about 30 to 40% of Euro parliamentarians to sign this petition, which was quite a feat, but didn't lead anything to anywhere because it was the end of the term. But in doing this, what we found out that there was a hurdle that we didn't have a list or inventory of what are the civil society organizations across the region. So then, while KNCV had led this initiative, at the end, Patrick Bertrand of Action for Health or proposed, let's organize the civil society in the region. And so so that's where the TB Europe Coalition was framed. And we really said, what are we missing? We want to have at each national level patient organization, a national Stop TB partnership type of activity, and where it's a way to convene people at national level and to collaborate with and demand action on TB. What we said is it's really convening that national voice and connect it with the regional peers. And that's what we set out to do as TB Europe Coalition, going to various countries, especially in the eastern part of the region, to set up this response. And this really was about shaping the partnership, the offer of partnership by civil society, and shape it.
So that meeting, June of 2009, is the creation, but a rather accidental and casual creation, of TBEC. But that led to Charlotte Gaillon, myself, making contact initially in Ukraine. And we visited Ukraine in 2010. And that was the first of several visits to Eastern European countries, where we were trying to connect with local civil society and have conversations with them about what kind of advocacy would be helpful, and how we might coordinate. But then I was particularly struck one day by talking with one of the people we were by then in touch with in Romania, who said to us, well, look, it's all very nice, you chaps coming along and having a chat with us, every now and again. You're friendly people, that's okay. But what are you going to do for us? And that led to a conversation where we started talking about advocacy training workshops. And that fitted with what they were wanting. It also fitted with my own personal background, professional training in organization behavior. So anyway, the first of these workshops took place in Romania in 2010, I think. And over the next 7 or 8 years, it led to a program that we had at least one such workshop, 2-day workshops on advocacy aimed at local civil society in every one of the now ECA countries, Eastern Europe and Central Asia.
So back in 2010, I was working for Global Health Advocates, and it was an NGO that was doing only advocacy on tuberculosis in Brussels, so towards the EU institutions, and in France. Because we were a small NGO, 1, 2, 3 staff back at the time, we always had this philosophy that our advocacy, so our power of influence, would be much greater were we to be together with others. We would have more weight. Our messages would be more significant if we had larger networks, larger coalition in place. So that's when we started looking at coalitions that we could be building, knowing that there were other people doing TB advocacy, not so much in Western Europe. This is why we started looking at creating a European coalition working on TB. And this is why Global Health Advocates, together back in the day with 2 other organizations, Results UK and TB Alert, and even before with Stop TB, the Stop TB partnership, looked at putting more energy into doing TB advocacy via this new coalition, trying to gather much more actors active on TB advocacy in Eastern and Western Europe. So we use these organizations, the funding that we received back then from different donors to develop that project for more impact in our TB advocacy. There was clearly a divide back then on the Western style or the Western type of NGOs and the work that we were doing, which was much more advocacy. There were some organizations working on helping TB patients, but obviously the rates of the disease were much less significant in Western Europe than in Eastern Europe. And in Eastern Europe, you could see not so many organizations, but quite a few organizations still doing service provision for most vulnerable groups. So civil society groups that were very close to certain people who were more vulnerable to contracting tuberculosis. I think we also back then were inspired by the whole movement, the HIV movement, the HIV activist movement, and thought that tuberculosis was also seeing very much increase in number of cases, especially in Eastern Europe, Central Asia, especially in its drug-resistant forms, and thought that, seeing some of the results that were achieved via the HIV movement, that it was important also to start doing something much more strongly, much more efficiently on the TB front.
I work for the Global Network of People Living with HIV, TNP+, as the liaison officer for the community delegation on the board of Unitate. I remember quite clearly when we started TB Europe Coalition in the 2000s, when I was still living in Europe. I was the chair of the European AIDS Treatment Group at the time, the EATG, and as such, we wanted to become far more involved in the co-infection work with tuberculosis, because in Europe there was no work done. So we were part of a small steering committee with Paul, with Fanny, and I was representing the HIV sector in TB Europe Coalition. And so yeah, those were amazing days. There was no funding. It was very European, Western European based at the time. And I personally moved to South Africa in 2012. So then I left my European work behind, but I kept on following the great work that TB Europe Coalition is doing.
So the idea behind creating the TB Europe Coalition was obviously to ensure that decision makers, politicians, governments would implement more ambitious policies to fight TB, and also dedicate more funding to the fight against TB, be it at national, regional, international level. Another very important point was, and that really featured into the work of the TB Europe Coalition, was to ensure that civil society would be recognized as a critical partner in developing the policies that would regulate the fight against TB. So civil society has never, at least back in 2010, was never really considered as a respected actor and stakeholder. We were always really much on the margin of the decision-making process when it came to TB. And it was quite interesting because you could really see that all of the conversations were very technical, using very medical languages, a lot of jargon. It was not a very an easy field to enter in and to understand how to influence it. So that was also one of the objectives of TB Europe Coalition, is to give a human face to the disease. A lot of the NGOs that were working on TB knew the reality of people having TB, the reality of treatment, diagnostics, or the lack thereof. And it was very important to hear those voices, and that those voices be included and considered when any decision, any policy, any program was being developed. So that was one of our main fights throughout the years, is making sure that whenever there was a new program being put in place in a country, even though that it was very medical, that actually the patient, the community's voices were being heard. And that's it was definitely not a reflex. So that was a constant fight. In terms of how this all started, we were just a couple back in the days that were really looking at developing this project. TB Alert, Results UK, and Global Health Advocates. So 3 NGOs based in the West, based in Paris, Brussels, and London. And the first thing that we've done to create this coalition is very simple. Basically, we just used some of the funding that we were receiving to develop that TB advocacy, to travel to high burden countries where there were high rates of tuberculosis or drug resistant tuberculosis. Travel to these places, do a mapping, meet the people that were actually active civil society organizations. Sometimes in some countries there were just one. Sometimes in some countries it was the Red Cross that was doing quite a lot of different activities that included tuberculosis, for instance, in prison or with migrants. So we basically went to, in between 2011 and 2014, I think, to 8 or 9 countries in Eastern Europe and Central Asia, Moldova, Georgia, Azerbaijan, Bulgaria, Tajikistan, etc., to meet those people and to create basically that movement. And we were always very much welcomed. We used also always those visits to actually meet ministers or meet decision makers in the health field and bring civil society organizations with us to open some doors, and also sometimes to do even advocacy training. So explain, or because a lot of the civil society organizations there were active in service provision, but maybe not so much in advocacy. So explaining how, they could also change decision making and influence their decision makers. So that was basically the first series of activities that we were doing, and quickly we also worked very closely with the WHO Europe. We had staff there that were very understanding and eager to work with civil society, even obviously if their ways of working is maybe a bit less flexible than civil society. I think we managed to build very good relationship from the start, and ensure also that when there were revision of a national TB program TB programs, that civil society would be including in these national reviews, that civil society would be invited in any meetings in Copenhagen, linked to thinking how to take the fight against TB in Europe forward. So I was myself elected chair of the first regional collaborative committee on TB that was then later enlarged to include HIV and Hep C in the region, I think back in 2013. So we really worked on developing this relationship, which also opened doors to a lot of us and to be at the table. Also in regional international meetings, we also had, then we developed a lot of patient advocacy, where we had patients from Moldova, from Tajikistan, from Azerbaijan who spoke English and could be invited to meetings. So that's how, we really grew the movement. And then I think in 2015, we also, because we were doing a lot of advocacy in Brussels and trying to really increase the level of engagement and the level of awareness on tuberculosis, we managed to convince the Latvian presidency to host a ministerial summit on the issue of transition of the global fund from middle-income countries. So that also helped us develop some very good relation with the Global Fund itself, and plan high-level meeting, have access to high-level decision makers in the field, which I think elevated us as a trusted partner. Meanwhile, we continued to grow the movement, to have obviously a lot of people work in the secretariat, which was still very much informal, but worked in maintaining those relationships, organizing webinars, organizing trainings, making sure that our patient and community activists were invited to international events like the Union Conference. So making sure that our voices was always heard, whatever was happening in TB policy, TB advocacy, we were making sure that we were there, that we were contributing, that our voice was being heard.
In the early years, we very much enjoyed being a very informal, unregistered, unregulated organization. There'd been that earlier history of Stop TB Partnership Europe where we had failed because we'd been trying to be too organized. But gradually we realized that if we were to continue and if we were to receive grants from major donor agencies, we would have to be properly registered. And then came TB Rep, the global fund making available funds for an initiative initially pushed by WHO Europe and the Moldovan organization PAS, with the PAS as the principal recipient. And by the time that proposal was finalized, we had been drawn in because we'd been developing contacts, particularly with WHO Europe, and they drew us in and we saw ourselves as being able to provide the civil society linkages for that particular program. And that was all about trying to encourage and assist countries in Eastern Europe and Central Asia, i.e. the ex-USSR countries, to move more rapidly away from the sanatorium model that they had been used to ambulatory care for TB, such as was by then the standard practice in Western Europe and across the rest of the world, Africa, Asia, Latin America.
So for TB project, we were advancing the people-centered models of care. We were very much closely working with TB activists and civil society organizations in Eastern Europe and Central Asia, and also with the partners in Western Europe to operationalize what qualitative, people-centered TB care should look like amid the healthcare reforms which the Eastern Europe and Central Asian regions has been undertaking at the time. So we were advocating for inclusion of the components of psychosocial support and broadening perspectives of care at the outpatient settings, from biomedical to holistic comprehensive care, which would see a person with his or her their life circumstances and needs, which should be addressed in order to support the successful pathway to treatment.
And that made a big change for TBEC because that meant we were now responsible for an actual program that had to be delivered. So we needed staff, and we needed those staff to have a base. And so we talked about where should we have a secretariat, and there were 3 or 4 places suggested. But eventually there was a bid from Alliance for Public Health Ukraine, and we thought, yeah, that sounds about right. That's good. It's a well-structured organization that's very competent. It's already present right in the middle of the area we're concerned with. It looks like a good place to be. And so TBEC became Ukraine base, but still we're doing work across the whole of the region. And so we began to really become the regional organization that we had thought about in the past. And also, apart from those workshops on advocacy, we also had one series of 4 workshops which were aimed at NTPs to explain to them what is civil society and how might they work with civil society.
I joined TB Europe Coalition in 2016. At that time, it has not yet been officially registered, but it was a growing multi-country network supported by the very active steering group. So at that time, I was technically hired by Alliance for Public Health as a TB advocacy manager for implementation of the regional TB REP project. It was the first regional tuberculosis project supported by the Global Fund, and Alliance for Public Health and TB Europe Coalition had this partnership arrangement for implementing part of the TB REP project.
With a lot of energy and the right people, we managed to grow and eventually decided that we would register TB Europe Coalition as a foundation.
And so in 2016, we finally agreed that we would get registered. We started looking, we went through quite a process to decide which country we would register. And we eventually settled on the Netherlands. Partly because it was a member of the European Union, and we were concerned to be able to access European Union monies. And also we were told that it was a rather relatively easy process to get registered in the Netherlands, which it is, but it is not an easy process to continue to be registered we have had lots of hassles with the registration authorities in Netherlands. But still, that's where we are registered. And once to get registered, we also had to have a proper constitution, a proper structure. And so we organized, so we did through late 2016, early 2017, we did finally set up a very traditional sort of structure, that there is a board with a chair and co-chair and a couple of vice chairs, and then staff based, as I say, in both London and Kyiv. And that structure we maintain still today, and it seems to work reasonably well for us.
We have also been working very closely with TB Europe Coalition Steering Group, many of whom became the board member or oversight advisory committee members later on when the network has been officially registered. And we have been working on development of strong and inclusive procedures to run the organization, and kind of creating it administrative and operational capacity as a prerequisite for further successful operation after the registration. There were a lot of administrative work at the time to develop their procedures, administrative documents for TB Europe Coalition, all the issues regarding legislation, and we were collaborating with staff also of Results UK, Global Health Advocates, with TB Alert. So I think we were having like a real partnership across the region and across the Europe to make it happen. But I would also like to say that for TB Europe Coalition, for me, the major driving force is also TB advocates and TB survivors coming from Eastern Europe and Central Asia, whose experience of fighting the disease, whose enthusiasm was really like a driving force for organization to happen and to find its secretariat being located later on in Eastern Europe and Central Asia.
But it's important that we have since also registered a separate organization in Ukraine to be able to make bids to donors who are only interested in giving money to low and middle income countries. And I should also briefly mention that we did have, for also almost 6 years, we had a team working in London because Results United Kingdom had made a bid to the European Union for an organisation grant, and that was done on our behalf. But it came through Results, and so the team was situated there. So quite a lot of work was done in those years by people based in London, as well as the TB rep focused people based in Ukraine.
After the registration, So that was the first time when we were working closely with Paul Sommerfeld as chair of the board to have the first round of hire for TB Europe Coalition Secretariat based in Kiev, like consolidated secretariat. And then I think it was 2018 when our first TB Europe Coalition dream team came true, and we were very excited that we now have the staff and the project and activities to support the network and development of network across Eastern Europe and Central Asia, as well as capacity building activities for civil society and TB advocacy activists across the region. So yeah, that's been very inspiring time.
What makes TB Europe Coalition unique, I think, is the strong leadership we have seen. First by Patrick, then he passed it on to Fanny Voitswinkler, and then Julia. So 3 succession of people who have really driven this initiative and really to go from strength to strength. And seeing the secretariat, which used to be just 1 or 2 people in Brussels or in London, now being 6 persons in the Ukraine and really driving a program and getting things done on the ground, but also regionally, is incredibly admirable that has succeeded. So, and it was almost like a estafette from one organization to the next, who saw the value of what TB Europe Coalition could do and took ownership of it. And it happened pretty organically. So I think what is really good is you see an institutionally strong organization. You see a chain of persons who have really driven it, and a strong commitment of partners. We are now building on the expertise in Eastern Europe to make a change in the Western European region. And so that thing about TB problem being at our doorstep to the West, but also the EU has to have a role in addressing cross-border health challenges, and how we are mutually connected really is a clear reality today.
I think one of the greatest achievements is that we were struggling in the beginning to make it a real European region coalition, meaning it was very Western European, and we struggled to get Eastern European colleagues involved. And I see this has totally changed now, and I'm really very happy for that. So because that's where the main burden of the disease is in the European region. So it's good that we are focusing on that. And I'm very proud of the work that TB Euro Coalition is doing these days.
We're very proud that a 10-year effort ended up in having an organization that stands now by itself, that is funded, and that doesn't need, the volunteer energy of different organizations. So we feel that the mandate has been definitely fulfilled. Now there's much more to be done to end TB in our region, and I think it's in very good hands.
So now we're reviewing our strategy again, but bearing in mind that we were an organization that started with Western advocates concerned essentially with the European Union, and we have become an organization mainly run by Ukrainians from the Secretariat and concerned with activities in Eastern Europe and Central Asia. So I think it may be, as we talk about our strategy, we may try to rebalance that again and say, wait a minute, we shouldn't be forgetting Western Europe, but remembering that Western Europe has a much lower level of tuberculosis, but not a nil level of tuberculosis. There are issues about TB services in the West. But we also need to be building and finding ways to continue and grow the work that we are doing within ICA and supporting and working with our many partners in ICA. So I'm optimistic that TB Europe Coalition will continue to exist and will continue to build itself as an effective piece of infrastructure that other regions will be jealous of. So that's what I'm looking for at the moment, that we do a good job for providing and ensuring more action by civil society in TB care across our region.